respected directors at Prathima Cancer Institute, doctors, nursing and paramedical staff, and postgraduates of Prathima Karimnagar, Sahasra Pharmacy, and students, and other respected professors, HODs of various other colleges, and students. I am Prateek Boinapalli. I'm a doctor, I'm an internal physician. I'm the director at Prathima Group of Hospitals at 3 locations, Hyderabad, Warangal and Karimnagar. When it comes to Warangal, the brainchild of Prathima Cancer Institute is of 2 persons. One is my father, Mr. Vinod, and one is Mr. Srinivas Rao. He is the chairman of Prathima Group. He is my uncle. These are the 2 persons of brainchild of Prathima Cancer Institute. We 3 have an emotional attachment to this institute and this place, as we are native of Warangal. In our family, my grandmother and my grandfather and other relative, we have lost due to cancer. So the basic idea of establishing a cancer hospital in Warangal is due to these reasons, because all the family members which I have mentioned all are from Warangal only. When my father was an parliamentarian in 2004 from Hanamakonda, he did a screening camp in Bhupalpalli. So at that time, I think Mr. Kiran also, he was the part of that screening camp at Bhupalpalli. We have done 3 days at Bhupalpalli. So among those 3 days of screening camp, I think around 15 to 20 patients got positive and we got operated at Karimnagar. I'm happy and I'm joyful to say that those 20 people are still alive of those 3 screening camp which have done 15 years back at Bhopalpalli because of my father. So this was the spirit and idea to establish this hospital. The basic idea of all these students bringing up to this platform is of few agendas. The primary agendas is, the first agenda is, I've been to many countries in the Western world. Among those Western world, they have stipulated guidelines among their countries. When the persons attain the age of 50 or 60, they tend to have screenings for their respective age. As we youngsters, normally at their respective countries, they gift their parents or mother, father, or any of their relatives that you should do some screening of their gender. So I think in India, we don't have those guidelines. So as an youngster, I'm also an youngster and you people are a youngster. So we make sure that we'll encourage our parents, grandparents, or any other relatives in our family to get screened. Normally, the word cancer in our society, there is a social stigma. Okay, if there is some cancer in their respective family, they think, okay, this person will be no more in due course of time. That's not true. That's not true. The technology has developed rapidly from last 2 decades. So many people are being treated and getting survived through their lifetime. So through this platform, I would like to take the help of all the young people who are this part of awareness program to make sure that you pass on this message. Normally in the society, the doctors or the paramedical staff or the hospitals can't do the screening camp at all. So in this society, we need young people like you to pass on this message to all section of the society of the people to make sure that they get screened at due course of their lifetime. And the second part is, okay, all doctors and everybody is saying cancer is for older people. See, cancer is not for the elderly people. It can come for the youngsters also. So you please, if you have any signs of other, and if you feel weakness or any changes which are mentioned by our doctors, please go and get it consulted, because cancer is a very dangerous disease. It can easily pass on.
To pass on my message to your directors of your respective colleges. Thank you for coming here and gracing the occasions. Thank you, one and all.